Okay, looking at the anterolateral head here, you can see a large muscle up here, which is called the frontalis. And the frontalis is part of a larger muscle that goes to the back, and this is the occipitalis. So there's fascia in between called the galla aponeurotica. So the frontalis and the occipitalis are actually one cowl of a muscle, which they call the occipitofrontalis. Now laterally you could see a muscle here covering the temporal bone, and this is the temporalis. Then you see two small muscles that are in a group around the ear, and they're called the auricularis. So watch this zone right here, temporalis, auricularis, occipitalis, frontalis, and the galla aponeurotica. Now while we're here, we'll look at the triangle of the neck muscles. And the most posterior muscle that comes all the way down and forms a diamond shape, this is called the trapezius. And this you're going to see on both sides. Anterior, very superficial, you have a muscle that kind of floats down towards the pectoralis and the deltoid. This is called the platysma. And right behind that, deep to that, I should say, is your sternocleidomastoid, and the platysma is covering it up. So if you look on the other side, you can see the sternocleidomastoid clearly because it has connections to the mastoid, the sternum, and the clavicle, which is cleidoid. So this is known as the SCM. Here's the left trapezius. Now there's a triangle of muscles in here, and the one you need to know the most is the one in the middle called levator scapula. This is the splenius capitis. These are the scalenes. So in this triangle, you should see the trapezius, the SCM, sternocleidomastoid, which forms the triangle, and then dead center is the levator scapula, splenius capitis, and scalene. Again, you can see the temporalis very good on this side. So let's go to a little more superficial facial muscles. And here you could see the circular muscle called the orbicularis oculi. And there's also a circular muscle around the whole mouth called the orbicularis oris. And then right here you have a muscle, smiling muscle, that has its origin on the zygomatic bone and its insertion down in the labia, the lips, or the orbicularis oris. This is called the zygomaticus. And you have a major and a minor, but you just have to say zygomaticus muscle here. This muscle, superficial, also involved in smiling and drawing the labia back, is called the risorius. Now deep to those muscles, right in here, you have what's called the buccinator or buccinator right in here. So zygomaticus, risorius, buccinator, orbicularis oris. Then we have a couple other muscles down here on the angle, on the mental area, is the depressor anguli oris. And right here you have the depressor anguli inferioris. So angularis and the inferioris. Depressors, they're both depressors. So check your list. Here's the platysma, and here is a big muscle on the angle of the jaw, and that's called the masseter. So again, auricularis, temporalis, frontalis, which is part of the occipitofrontalis. So the occipitalis is here. The orbicularis oculi, and you have a nasalis too, right on top of the nasal bone, nasalis. And then you have the orbicularis oris, the zygomaticus, the buccinator, the risorius, the depressor anguli oris, depressor inferioris, and right here you have the masseter. This is the parotid gland, not a muscle. This is your sternocleidomastoid, platysma, your levator scapulae, and your trapezius.